Hello and welcome. Today we are diving into a topic many people struggle with, and that is digestive discomfort, specifically the irritable bowel syndrome, or in short, they call it IBS. And today I'm joined by Dr. Stephen Kairu, a specialist in digestive health. Dr. Thank you. Help us understand what IBS really is and how we can manage it better.
Thank you very much for asking me to talk about IBS. It affects so many people that we can imagine, and most of the patients suffering from this condition find no help when they go to the clinics, and that's why I like talking about it.
That's interesting. So you're telling me that IBS is a common disease that
It's
people have?
very common.
Yeah.
The only thing I like emphasizing here is because it is mainly not diagnosed, and we all know that to treat a disease, the first thing is to diagnose it. So they are left untreated, and that's why they become very frustrated.
Okay. You're saying people suffer in silence, that they don't know what is eating them up.
Well, at least they try to go to get help. Unfortunately, they don't get help because most of the people or the doctors and the hospitals, they are unable to diagnose IBS. And that is why the emphasis of this talk today is on how to diagnose it and to help patients so that they don't get symptoms going on and on without help.
Okay. How would someone know if they might have IBS?
Yes, good question. There are three main symptoms that patients of IBS present with. It's so easy. They have long-standing, on and off, one, abdominal pain. Number two, they find that their stomachs are bloated, meaning there's a lot of gas accumulation in their stomachs. And number three, they always note that going for the long haul is not normal. It's either hard or loose or changing biohabits.
What causes IBS?
Yes, a good question. Many patients ask me. Um, it's a condition where a lot of studies has gone in, and we have found that the normal rhythm of digestion, meaning that from the stomach, pushing the food out of the stomach into the intestines, and pushing the stools out of the colon, large intestine, becomes abnormal, either a bit slow or a bit fast. And we have also learned that our brain interacts very well with the digestive system. So we believe there is a problem, a disturbance in the interaction between our brain and the intestines. And therefore, in terms of getting the symptoms, I can explain here where the symptoms come from.
Yeah.
In the stomach, the food delays a little bit longer to get out of the stomach. So as the food remains longer, digestion is continuing, produces an excess gas where the bloating comes from, causing pain and discomfort. Going down there to the large intestine where the stools are propelled, the rhythm is abnormal. Either too slow, the patients who would go for the long haul after 1 day, 2, 3 days, 1 week without going, obviously to be constipation. On the other hand, we have the other group of people where in the large intestine, the rhythm is abnormal in a different manner, the opposite. It starts moving rather fast, abnormally, causing them to go and pass stools, lose stools 2, 3, 4 times a day, often having the urge to go for the long haul. And when they go there, they only are able to pass small quantities of stools, and they feel when they're in the toilet that a lot of the stools has not come out. They tend to stay longer in the toilet.
It really sounds to me like H. pylori. Is it related?
I like the what you're coming out with this H. pylori. It's a big issue, and I like mentioning it because let me start this way. Almost all patients who come to my clinic with IBS, they have all of them been given H. pylori kits. They put the medicine in a box or a kit, and a number of them unfortunately have taken it 2, 3, 4, 5 times. Let me mention one or two things about it.
Personally, I've been treated of it. I remember I took those tablets.
Yes, it makes me make a few comments about this bacteria H. pylori.
Yeah.
It is present in about 90% of everybody in our stomachs. It enters our stomachs when we are born. It lives there, causing many people no symptoms. And since it's silently living there, and the test for the H. pylori is two tests. Many people coming with the symptoms of IBS, the ones I've described, when they go to the clinics, any clinic, number one test is two tests for H. pylori. Can you see it is almost likely going to be found? It's already existing in almost everybody. And therefore, unfortunately, they start getting treatment for the H. pylori, and H. pylori is not the cause of their symptoms. So you can imagine how they continue suffering, wondering why this H. pylori is causing symptoms and they are not going away. They go to another doctor, another kit, another doctor, another kit. And the more they do that, they get more anxious. And remember, you said the more they get anxious, the more the IBS symptoms increase. So they are in real trouble.
Wow, interesting. That explains why it's so common. Kila mtu unasikia tu niko na H. pylori. Think hata umesikia kuna H. pylori, remember kuna H. pylori.
Hata wagonjwa wananiuliza H. pylori imekuwa mingi namna gani? Not like that is the meaning. It is because doctors are just doing two tests for it, and they are missing the real disease that took the patient to the hospital.
Yeah, so when people are stressed, whether it's at the workplace, relationships, money, like right now, Kasongo, the economy, and everything, is stress connected to the digestive discomfort?
Absolutely correct. Most of my patients, when they come, we talk and they bring out some of the things you're talking about that they have already noted themselves. There was a lot of stress in the workplace, too much work, the bosses are rather not treating them well. Another family matters we talked about, and they noticed that the symptoms are worse off. We have learned, like I said earlier, our digestive system, the gut, works together, directly connected with the nerves to our mind, to our brain. And therefore, if there is stress here in the brain, through that connection, it makes the symptoms become more felt. So we found a real relationship between the stress, the anxiety, and IBS symptoms. So first of all, I have seen many patients who come to my clinic. I have seen the patient many times before. Then they come back again and we chat. And I find out, sometimes I volunteer to find out whether there's anything happening to their lives. And they said, yeah, oh yes, there's a lot of pressure in my workplace. There are issues in my business. You know, as we are saying, the business has gone so low, of course, affecting a man's mind who is a main bread earner. So it does affect directly, and we have learned about that fairly recently. Yes.
In your example, you've given an example of a man. Sorry, maybe this is not part of the interview questions. So, but does it affect one gender more than the other?
Something that is good you're asking. I think it has been mentioned even in our literature books. They usually say that there are twice as more females than males. But when you look at the patients we see, we think that it's likely that more women, when they have the issues disturbing their body, like the bloating, discomfort, they are the ones who are more likely to go to the doctor. Men are more resilient. If there is some disturbance in the tummy, I think that's why we see more females than men, because they present more frequently, even though most likely the cause in terms of what we think affects equally both. But patients, females, present themselves more frequently.
I find that to be a very powerful insight. So many people are likely to confuse and feel like they have like a stubborn H. pylori or something. But in real sense, you're saying it's IBS.
Yes, absolutely. It's like you're asking what my patient tell me. Yo, I have this H. pylori which has refused to go away. I'm going to many clinics, many hospitals, and specialists, H. pylori. And they wonder why it is so stubborn. First of all, they are believing that it is the cause of their symptoms. They have IBS, but because it is not diagnosed, the test becomes positive many times, even after H. pylori kit. Remember, there are bacteria which become or have become resistant to these kits. So that is why they have stubborn symptoms
Yeah.
of H. pylori and is many times come out positive.
Mm.
And I tell them, incidentally, even before I go deep into history,
Mm-hmm.
I usually start by telling them most likely H. pylori has never been a problem. And some of them are like amazed, looking
Shocked.
back at the time they have been treated,
And how many
months
times
and
you've
months
taken
and a
medicine.
lot of money. And then I'm saying for the first time, it has never been a problem. They are like, hey, they want to hear more now. This is a long story.
Interesting stuff. Well, is it something that people can be able to live with forever?
It is a condition that, maybe they put it this way, is it treatable completely and goes away? That is what patients tell me, which is very pertinent. The human beings want a condition to be dealt with and they get back to their normal selves. And I tell them three things about IBS. I usually start by telling them there is, number one, something good about it, if one can say good, that it does not damage anything inside your intestines. There's no ulcer, there's no colon cancer, which is feared by many, or injury. The intestines inside remain the same. Remember, we said the problem is abnormal rhythm of movement of the intestines only. So inside remains the same. I'm saying that because some patients have come who have been very, very worried. They have heard about people who have long-standing tummy issues. Later on, one was found to have colon cancer. And here they are. They have been undergoing long-standing problems because they have never been diagnosed properly.
Yeah.
And therefore, the patient is good, at least. Nothing serious inside. Number two, the problem with it is that it causes the life of a patient become very uncomfortable all the time with the pain and bloating. And remember, maybe something I didn't mention here. Like any disease, there are mild IBS and severe IBS. Severe IBS, they have all the symptoms of pain and bloating and not going for the long haul well. But since the brain is involved, they also lack sleep. They don't sleep well, also sleep at 3 a.m., 4 a.m., 2 a.m. Number two, it affects the muscles. They are generally fatigued, tired. Others have headache and dizziness. So imagine those are the patients who have very difficult quality of life with the digestive system issues, plus the other symptoms that are not in the digestive system. Those are the severely affected IBS.
Yeah.
Wait, I was still answering your question.
Yeah.
Number two, problem with it, I have told you, it makes the life of a patient very uncomfortable with others. So when I diagnose and put them on medicine, the symptoms go away. They feel good and they are happy. Some of them after a long time after taking the kids. But number three, we don't have a medicine in the whole world. We are still looking for it to make the symptoms of IBS go away and not come back.
Yeah.
But it's not a condition to be taking the drugs all the time. They finish the dose they are given and they feel good, and even after finishing, they continue feeling good. But later on in future, we don't know whether it's 1 month, 6 months. Some symptoms do recur. If they recur so mildly, they may not require medicines, but occasionally, if the recurrence is quite severe, they may require some medications. But it's also good to mention here that when they have come, maybe going back a little bit, and I've diagnosed them, they are very worried because of the way they have never been diagnosed. I always do a quick endoscopy or colonoscopy, and I tell them I'm not doing it to look for your disease. I know this is IBS, it's a rhythm problem, but it's good for me to find out what level it has reached. Also make sure there's nothing else, because IBS a person can also get another condition inside the intestine. So I always carry out a quick endoscopy colonoscopy to finish the story, not to diagnose it. Because I'm saying that because my patients coming to me, they come to me carrying a packet of photographs of endoscopy colonoscopy that's elsewhere. And obviously, if you do endoscopy colonoscopy without knowing that this is IBS, maybe just to emphasize, IBS is diagnosed by just asking the symptoms, the characteristic pain and bloating and not going for the long haul only. And therefore, no test is done to diagnose IBS. And therefore, after diagnosing it with symptoms and endoscopy, of course, I've just mentioned not looking for the disease. And therefore, the ones who come carrying photos of endoscopic colonoscopies,
Yeah.
And of course, they have not diagnosed the condition, because if you do an endoscopy on a patient who has IBS, many times it would be normal. But the doctor was doing endoscopy hoping they are going to see something in the stomach that is causing the patient's symptoms. So it's usually not helpful to do endoscopy, colonoscopy on a patient who has not been diagnosed with IBS.
So it's easier to probably the first option a patient would probably look at is find out if they have IBS, right? Before they go for colonoscopy and all those other tests.
That is exactly the right way. But we're having a discussion because
Yeah.
I said that IBS is like completely forgotten. And therefore, the doctors are doing colonoscopy because they have no idea about IBS.
Yeah.
They are hoping to see something in the stomach of this patient complaining.
Okay.
They will not find anything at all. And therefore, causes more frustration to the patient.
Sometimes people just assume bloating is normal. But what are some of the signs that shouldn't be ignored when it comes to bloating?
I think it's correct, because I think bloating on itself is quite common, and one of the bothersome symptoms in the digestive system. Of course, if the bloating is causing so much discomfort and persistent, because some people have on and off bloating, if it's persisting too much, if it is too much until it is associated with the symptoms, like what patients tell me, acidity symptom, meaning reflux or heartburn with bloating, it is something that tells me that, hey, this needs to be checked, either with endoscopy, or I listen to them, I know what to do. But obviously also, remember we said bloating goes together with abnormalities in going for the long call. If the stools are not normal, again, bloating alone should not be ignored.
Okay. Okay. When should someone maybe stop seeing a doctor?
With
Kienda sana the bloating, or with all these symptoms and all that?
I think human beings are the same. If some symptoms of bloating, it is not stopping them from going to work, doing what they are doing. They still carry on, but occasionally it becomes a bit too persistent. And remember, bloating is not one level.
Yeah. Sometimes
the gas is too much, and for the bloating, you cause even pain and a lot of discomfort. And also not eating well. They tell me that they have lost appetite. What they really mean is that the stomach is already full of gas, so where you want to put more food, there's no space. So nakula kidogo wanashiba.
So hiyo kubloat mtu anasikia could be a bigger thing.
It could be a bigger thing, a bit, because sometimes, of course, as I said, IBS patients can get other diseases, so they are listened to well.
Maumivu yakizidi muone daktari.
The symptoms of IBS are not constant. They are sometimes rather troublesome, sometimes very mild. But when the symptoms become rather constant, because it's on and off, or they become so much they're interfering with your daily life, workplace, they are affecting your quality of life, including the interaction with people, because when people have severe IBS, they tend to shy away, they don't socialize, and therefore when it's affecting your life with all the things we mentioned, and because we can add by saying that it affects the quality of life. If you think it's affecting your quality of life, it's always advisable to come and see us, and we see what we can do to return back your life back to normal.
Okay. The saying Dr. is telling us that you don't have to wait until the pain is so unbearable. Ukisikia kama ina affect kitu unafanya, then you probably need to see a doctor. Hiyo kubloat na bloat sio kawaida.
Correct.
All right. That talking about digestive discomfort, definitely we are looking at food. Are there specific foods that people should stay away from that probably cause IBS or
good question, because almost all patients and expected, they always ask me after discussing IBS, what can I avoid in my diet? And I tell them, number one, it's not a food problem. It's a digestive system issue. It's the stomach which is not doing well, not the food. And because most of them were expecting me to tell them don't eat this, don't eat that, don't eat that. I tell them, no, you should eat everything. But obviously, as all human beings, many patients have had IBS for a long time, and they have already noted, almost all of them, in human would, noted that there are some certain type of food they take or drink and increase, not cause, increase symptoms, including or mainly the bloating. They actually talk to me about beans or sukuma wiki and bogas, milk, and more important, wheat products, ngano, chapati, bread, and all that. It's noted by all IBS patients to increase bloating more than the other. Therefore, most patients have already done something about it. They have noted this one causes more problem. They are just about it. They can stop it. They can reduce the amount. And when they do that, they are not curing IBS, but they make the symptoms much less, more manageable. And when I see a patient who has not come to the clinic for a long time, they did this and the symptoms have become much less and they can manage. Occasionally, they still come because sometimes other factors you come and make the IBS being triggered a bit more. So very good about food, and they are happy actually because many people do not want to hear that there is a long list of food that you should not eat. They are happy to hear
that's a favorite, someone's favorite.
Oh, the food is mine. Someone says wananiuliza na ile chupa yangu moja, naambia no problem, it has nothing to do with IBS unless it causes you issues. Yes.
So the goal is here to eat well, live well, and without constant
without cause undue pressure in your stomach.
Stuff. And that can emotional health really affect the gut?
Oh yes, it does. Of course, we had mentioned earlier
stress,
that of course stress affects all of us from different angles, different sources. Some of the things, unfortunately, we cannot completely control the stress. There are patients who are so stressed from their workplace, they can't stop working. That's why they get their daily bread. And other family issues, again, they still continue. So family issues, stress from work, jobs not doing well, so sources of stress, emotional stress, and there is probably some, depending on what they are, there's nothing you can do about it. But if there are simple things you think you can adjust in your life that can bring less stress, probably by people who jog around a bit and they feel less stressed and whatever else they do, chat with their friends and they reduce the stress, that definitely will reduce the symptoms of the IBS because of what you mentioned.
What is that one story that really stayed in your heart, in your mind, that every time you think about IBS, a picture of that one patient comes to mind?
There are many, but I pick one which was rather striking. It's a lady with two kids with these severe IBS symptoms that keep taking the patient to the clinics, the hospitals, of course, spending a lot of money, kits and tests which do not take them anywhere. And the husband here is those people who hand to mouth. There's not much money. They are casual laborers. And the husband finds that all the money goes to this lady, to the clinics, and then there's nothing much left. I think that started causing stress to the man. He was one who was now more stressed. Really. I don't know what happened to him. He said, no, I can't handle this anymore. He left. He left the lady with the two children. Then I happened to see this lady. Somehow, IBS, severe IBS, managed her. Came good. And do you know, started talking to the husband, and the husband couldn't believe it, that this lady is no longer sick. They almost came back. So I think I'll never forget that story. So that is one of the stories that I keep in my heart.
Interesting. IBS inaweza save your marriage. Great. Thank you for the insightful conversation, Dr. Kairu, and with the experience and a number of healed patients that have passed through your hands. Where can people find you? Where are you located?
Good. We are located along Gong Road in a shopping center called Adams Arcade. There is only one big building alongside the road called the Greenhouse, and we're in
Greenhouse.
first floor office number 19. And greenhouse, first floor office number 19. And we are there from Monday to Friday, from morning to 5 p.m. And also to mention that, as I said, we do procedures, endoscopies, colonoscopies. We do them. We have a facility in the clinic to do these procedures, as I said, just to finish up the diagnosis so the patient can get thorough treatment. We do the procedures in our clinic. It's also good to mention that we cover all medical insurances, and they all come to my clinic and we use it. And just to remind people that when we're doing a procedure, because it's required towards the end of a diagnosis, it always uses the inpatient cover, not the outpatient, although you are not admitted. In adding this discussion, just to remind listeners that patients with IBS are so many out there, easy to diagnose because they have bloating, diarrhea, pain, constipation for a long time on and off. They do not have to think of any other diagnosis, and especially the ones who have been taking H. pylori kits over and over again. Most likely you have IBS and need to see us so that we can at least treat you properly, diagnose you, and improve your quality of life. Thank you.
Thank you, Daktari. Kama wewe uko na shida ya bloating, maybe the time is now. The place is the greenhouse, first floor,
Number 19.
Number 19 kwa Dr. Stephen Kairu.
Good.
Kama shida ya tumbo, daktari ako hapa.
Asante. Thank you.